Classical conditioning is also known as respondent conditioning. Um, and you could remember respondent, you're responding to something and it's an involuntary function. And the best way to describe classical conditioning is a dog um, usually salivates when they see a bone. Pavlov paired a he showed the bone to the dog, and every time the dog would salivate, he would ring a bell. Later on, he took away the bone and just rang the bell, and the dog salivated. That's called classical conditioning because it takes place. It's what happens prior to learning the dog salivating. Okay, another type of behavior behavior modification is operant conditioning, and this is a type of learning in which behavior is learned because of the consequences. And there are various types of behavior modification therapies or techniques, I should say. So the first one is positive reinforcement. We all know that when a kid does good work and the mother praises him, she's giving him positive reinforcement. There's also negative reinforcement, and basically what that is um, if a person is exposed to adverse stimuli, they will learn how to avoid or escape that adverse stimuli by doing another action. Therefore, the other action, that is the behavior that is reinforced, and that's called negative reinforcement. There is extinction, also a type of conditioning, and that's the withholding previous reinforcements. For instance, a kid has a tantrum, and mother usually gives it attention, and mother stops giving the kid attention every time he has a tantrum. That behavior of the tantrum is going to slowly be extinguished. Then there is uh, positive and negative punishments. This is also known as adverse stimuli. You can remember it this way is punishment, positive punishment. The positive means something is added to alter the behavior. So for instance, um, mom says, okay, she makes the action. You're not going to get candy because you did this and that. The punishment is she's not giving candy, but what she did was an action. It was added. So think of positive adding an action. Then there's negative punishment. So it's still a form of punishment, but you're removing a particular um, action um, following a behavior. So, for instance, you get paid, you go to work and you get paid every Friday. Every Friday you're used to getting paid, and you come late to work that particular week. Well, after the behavior of coming into work late, your check would be withheld, say X amount of dollars would be withheld from your check. So they are not adding an action, but taking away a previously reinforced stimuli money. Okay, so those are the types of conditioning. Now we are going to, let's back up a little bit, talk about the theory. Basically, the theory is pretty straightforward. The person is the producer of their own environment, and the practice of behavioral therapy is based on the principles of the scientific method. Focuses on current problems and the factors influencing them. Clients are active, they have to do homework. It does not require insight, and the therapist focuses on assessing overt and covert behavior, identifying the problems, and evaluating the change. And of course, it's empirically supported. The clients, it's beneficial for the clients in that they really know what to expect. It's very well defined. The clients do have to be motivated to change. They are expected to experiment with the particular homework that they are given so they can generalize learning to the real world. If the clients are not motivated for behavior therapy, it's not going to work because uh, the therapy is based on the client's action and doing the work. Here's the type of interventions. There's relaxation training. Typically, there's 4 to 8 hours associated with relaxation training instruction. Systematic desensitization. This is based on classical conditioning, whereby you pair a non-exciting stimuli with an anxiety-producing stimuli, and that will generally decrease the anxiety associated with the particular stimuli. That's the problem. And then there's in vivo, and that's in vivo exposure. That's graduated exposure, say of a particular phobia, say a snake. There's flooding. That's intense and frequent and prolonged exposure without safety behaviors. Um, let's see. So, anxiety. The purpose is to decrease the anxiety through exposure. There's imaginal flooding, same as in vivo, but you do it in the um, therapist's office. There's EMDR. You must be trained for this. There's also social skills behavioral therapy, which often includes anger and assertion training. The stages of therapy are: 1, engage the client. The therapeutic relation is considered to be important to manage the crisis and to assess the problems and the consequences, and look at how the family can be reinforcing contingencies. The middle phase of therapy is to identify specific behavior, look at family. Do they reinforce or extinguish behavior? Then you are to provide homework by 1, modeling it, demonstrating it, having the client practice it in their office, giving feedback as they practice it, give them the homework to do in vivo, give them feedback on the homework, and and then that is it for the second stage. And the third stage is to review, explore um, as to how to maintain those gains that the client achieved. Also provide resources on this. There's other types of behavioral therapy: multimodal, which fosters a technical eclecticism; dialectical behavior, it's based on a blend of psychoanalytic theories and also behavioral therapies. The therapeutic relationship is very important in this particular therapy. Validation of the client is very important. One of the key tenets of dialectical behavior therapy, because we can assume some of these people that are in dialectical behavior therapy, where it's proven to work very well, is with borderline personality disorders as well as some eating disorders. So basically, you're validating the client's past, perhaps poor, distressful childhood. Um, and there's confrontation of resistance. You're doing that a lot. The client learns how to tolerate painful emotions through behavior therapy, such as exposure therapy. Another type of behavior therapy is mindful-based stress reduction. The goal is to train people to live in the present. Okay. ACT, which is acceptance and commitment therapy. This is a mindful-based approach, working on accepting the presence. Try to accept the presence instead of denying and avoiding feelings. And the commitment means choosing your values and how you decide to live by them. A lot of homework is given in this type of therapy. And a lot of behavioral exercises are given in this therapy. Let me just back up a little bit. The therapist's stance is to teach concrete skills through modeling and offering feedback, to conduct functional assessments or behavior analysis, which they're called, and that's to identifying the maintaining conditions of behavior. ABC stands for antecedents, behavior, and consequences. And the therapist strives to modify the consequences because the consequences are what maintains behavior. So you can increase or decrease the consequences. You can increase or decrease behavior through modification of the consequences. I think that is it. That's it. Yep. Okay. For 11 minutes. Possible. It involves significant others of the client if possible. Use the 3-point procedure for behavioral modification. So that is problem identification, identify what the problem is, establish a baseline, and that is specifying frequency, magnitude, and duration of the problem behaviors prior to intervention, and then to specify the conditions. Specify conditions associated with the problem behavior. Treatment and planning. If the client's problem behavior is operant, voluntary, such as compulsive gambling, these are some of the interventions you can apply. Note that whenever possible, these techniques should be applied in the client's natural settings with the involvement of significant others. Positive reinforcement. Arrange for desirable behaviors, target behaviors to be followed by reward. That's one. Extinction. If problem operant behavior has been sustained by reinforcement, arrange for these reinforcers to be withheld when the behavior occurs. Extinction. Response shaping. When the likelihood of spontaneous emission of a desirable behavior is very low, reward successive approximations of the desirable behavior. For example, if socially useful speech is the desired behavior for a mute, for a mute or regress psychotic person, you want to successfully reinforce sounds, then words, then gestures, then sentences, and finally sensible speech. So kind of shaping them with successive approximations. Punishment, arrange for an adverse stimuli to follow a problem behavior. Verbal instruction, uh, describe the desired behavior and explain how the client should go about engaging in that behavior. Behavioral rehearsal, this is similar to role playing. It involves verbal instruction, practice, feedback, and reward. Modeling, either model desirable behaviors for a client or, if appropriate, expose the client to suitable models, as in a skills development group or 12-step meeting. If a client's problem behavior is respondent, and that means involuntary, remember the dog salivated on his own, such as anxiety in a social situation, you want to use classical conditioning. And you want to associate a previously neutral stimulus with a desired target behavior. For example, assume eye contact is target behavior for an autistic child who spontaneously smiles when given candy. Arrange for the child to see the other person's face, a neutral stimulus, the bell with Pavlov's dog. This time it's a face, while the candy is given. Classical conditioning has occurred when the child looks and smiles at faces. Systematic desensitization. Deep relaxation is taught. Behavior associated with anxiety, um, um, like self-assertion. Well, I'm not too sure what this means. Okay. Behavior associated with anxiety is progressively associated with relaxation. Okay. For example, a non-assertive person is asked to think about something they want while they are in a state of deep relaxation. Later, the person is asked to think about something they want from a friend. Then they are asked to think about something they want from a stranger or